Anxiety is a big issue during the current health crisis. Managing this is important for staying focused and productive. In this video, I'm joined by Dr. Jo Burrell, a clinical psychologist who is going to be sharing tips on how to manage anxiety.
Hi, I'm Dr. Jo Burrell. Today I'm going to be talking about how to manage anxiety during the COVID-19 crisis. Anxiety is an emotion that we experience when we feel threatened. Often our bodies respond with feelings of threat because our brains tell us something bad is happening. Negative thoughts around catching COVID-19 ourselves or our relatives catching it are likely to be catastrophic as we fear the worst outcomes. We may experience negative thoughts about coping with isolation or about ensuring we have enough food supplies to survive a period of isolation. When we perceive a threat in these ways, our bodies react with heightened arousal, leading to symptoms such as increased heart rate, shortness of breath, tingling in our fingers and toes and sweating. We feel anxious, and this leads to further fears about what is happening to us and our ability to cope. The first thing we need to do is manage the symptoms of anxiety. We can do this by using the scientifically proven method of slow rhythmic breathing. This method helps to calm sympathetic nervous system arousal. It regulates our heart rate, rebalances the oxygen and carbon dioxide in our bloodstream, and starts to relax our bodies and minds. Although it seems simple, it can take some practice to learn. The key to success is to teach ourselves to breathe out for longer than we breathe in, to keep to a regular rhythm or ratio of in-breath to out-breath, and to pause briefly after the end of the out-breath. So let's try it now. So basically the technique is you breathe in over 4 and then you breathe out over 6. 3, 4, 5, 6. Pause. In, 2, 3, 4. Out, 2, 3, 4, 5, 6. You might notice as you're practicing this technique that the out-breath seems very long. If you find it's too difficult for you, you can shorten both breaths. As long as the out-breath is longer than the in-breath, this is the most important thing, so you can practice with different ratios. Practicing for 5 minutes daily will help you to get the hang of it, and then you can use it at times when your thoughts focus on negative or catastrophic predictions, or you notice physiological symptoms of anxiety. You will see that if you can teach yourself to calm your breathing, you'll be able to think more clearly again, put the fears into perspective, and find a way of solving the current difficulties that you're facing. This is a quick mindfulness technique that we can use to reduce anxiety and improve our focus and attention. We're going to start by stretching upwards, putting your hands in the air. If you have any neck or shoulder difficulties, just make sure you take care. Keep stretching upwards. Plant your feet firmly on the ground. Keep pushing upwards with your arms. And as you do so, you'll start to notice sensations in your body. You'll notice that your arms are beginning to feel warm. You'll notice the stretch up your back. You'll notice the feeling of your feet pressing against the floor. You'll notice maybe some tingling in your fingers. Really focus on those sensations. Notice how they feel. Now bring your arms downwards. Pay attention to what you can hear. Notice 3 things that you can hear. They may be behind you, in front of you, inside the room, outside. You don't need to label them. Just imagine them as sound waves entering your ears. Now notice 5 things that you can see. Again, no need to label them. Just look around the room and notice 5 things. Finally, pay attention to your breath. Notice it as it goes in and out of your nose, how it makes your chest rise and fall. Notice the sensation in your belly. This brief mindfulness technique helps us to unhook from difficult thoughts or feelings. It gives us a moment to consider, what do I want to do next? Do I want to carry on doing what I was doing before? Or do I want to approach things differently?
We hope you found this video useful, and I would encourage you to share it with others who might be struggling during this time. Do check out the TecQuipment YouTube channel if you're looking for content about engineering and education, and take a look at Dr. Joe Burrell's blog for more tips. Stay safe.